Welcome to Medical Terminology Practice Questions for Chapter 1 to 4. There will be 120 questions in the flashcards, images, true, false, and multiple choice formats. Question 1. A blood cell that produces antibodies: A. Monocyte, B. Basophil, C. Platelet, D. Lymphocyte, E. Erythrocyte. The answer is D. Lymphocyte. A platelet is A. Hematoma, B. Erythrocyte, C. Thrombosis, D. Thrombocyte, E. Leukocyte. The answer is D. Thrombocyte. Incision of a bone: A. Pathogenic, B. Osteotomy, C. Ostectomy, D. Endoscopy, or E. Sarcoma. The answer is B. Osteotomy. The what end of the thigh bone, femur, joins with the kneecap? A. Superior, B. Lateral, C. Distal, D. Medial. The answer is C. Distal portion of the femur. Select the correct medical term to complete the following sentences. The diaphragm lies where to the organs in the thoracic cavity? A. Inferior, caudal, B. Proximal, C. Distal. The answer is A. Inferior, caudal. A disc is A. A piece of bony tissue connecting the joints in the back, B. An abnormal structure in the back, C. Part of the hip bone, D. A piece of cartilage between backbones, E. A pad of fatty tissue between backbones. The answer is D. A piece of cartilage between backbones. Acromegaly: A. Exocrine disorder of bone enlargement, B. Abnormal growth of bones before puberty, C. Endocrine gland problem in young children, D. Enlargement of extremities after puberty due to pituitary gland problem, E. Fear of extremities, heights. The answer is D. Enlargement of extremities after puberty due to pituitary gland problem. What allows materials to pass into and out of the cell? A. Mitochondria, B. Nucleus, C. Cytoplasm, D. Cell membrane, E. Chromosomes. The answer is D. Cell membrane. Ana means what? A. Below, B. Up, C. Down. Ana means up, or to build, to synthesize, such as anabolism. Decrease in numbers of red blood cells or hemoglobin within red blood cells: A. Erythrocytosis, B. Anemia, C. Thrombocytosis, D. Leukemia, E. Leukocytosis. The answer is B. Anemia. Gastrectomy: A. Gastric resection, B. Tumor of the stomach, C. Incision of the stomach, D. Intestinal incision, E. Resection of the intestine. Gastrectomy means A. Gastric resection. An eosinophil is A. Lymphocyte, B. Leukocyte, C. Platelet, D. Erythrocyte, E. Mononuclear cell. The answer is B. Leukocyte. The control center of the cell is mitochondria, cytoplasm, nucleus, or ribosome. The answer is C. Nucleus. A photograph of an individual's chromosomes, arranged by size, shape, and number. Chromosomes, genes, DNA, or karyotype. The answer is D. Karyotype. Genesis is A. Condition of producing, forming, formation, B. Surgical puncture to remove fluid, C. Breakdown, destruction, separation. The answer is A. Condition of producing, forming, formation. The suffix plasia means what? A. Development, formation, B. Stop, control, C. breathing. The answer is A. Development, formation. Brady means what? A. Large. B. Slow. C. Fast. D. Short. E. Bad. Brady means slow. Deficiency in white blood cells. A. Leukopenia. B. Leukopenia. C. Leukopenia. The answer is A. Leukopenia. An abnormal condition of the kidney is A. Neurologic. B. Nephrotomy. C. Neuralgia. D. Nephrosis. E. Neural. The answer is D. Nephrosis. Separation, destruction is A. Ptosis. B. Malacia. C. Lysis. The answer is C. Lysis. Diagnosis is A. A guess as to the patient's condition. B. Made after the prognosis. C. A treatment of the patient. D. A prediction of the course of treatment. E. Made on the basis of complete knowledge about the patient's condition. The answer is E. Made on the basis of complete knowledge about the patient's condition. Dyspnea is A. Condition of lack of water. B. Difficult breathing. C. Abnormal formation. D. Inability to breathe. E. Inability to sleep. Dyspnea means B. Difficult breathing. Treatment is A. Pathy. B. Trophy. C. Therapy. The answer is C. Therapy. Excessive sugar in the blood. A. Hematuria. B. Glycosuria. C. Hypodermic. D. Hypoglycemia. E. Hyperglycemia. The answer is E. Hyperglycemia. Small vein. A. Venule. B. Venule. C. Venule. Small vein means A. Venule. Hernia of the urinary bladder is A. Cystocele. B. Cytocele. C. Cystocele. The answer is A. Cystocele. Feeling of well-being. A. Euphoria. B. Euphoria. C. Euphoria. The answer is B. Euphoria. High blood pressure. A. Hyperplasia. B. Hypoglycemia. C. Hypertension. D. Hypoglycemia. E. Hypertrophy. The answer is C. Hypertension. Iatrogenic. A. Pertaining to producing a tumor. B. Pertaining to be produced by treatment. C. Cutting into a tumor. D. Cancer producing. E. Produced by the mind. The answer is B. Pertaining to be produced by the treatment. The left lung lies where to the heart? A. Lateral. B. Superior. C. Proximal. The answer is A. Lateral. Meta means what? A. Large. B. Beyond, change. C. Bad. The answer is B. Beyond, change. Sarcoma is A. Mass of blood. B. Malignant tumor of flesh tissue. C. Skin tumor of epithelial cells. D. Part of the backbone. E. Flesh tumor, benign. Sarcoma is B. Malignant tumor of flesh tissue. High level of sugar in the blood. A. Hypodermic. B. Hyperglycemia. C. Hypoglycemia. D. Hypogastric. E. Hematoma. The answer is B. Hyperglycemia. Instrument to record is A. Scope. B. Scopy. C. Graph. D. Gram. E. Graphy. The answer is C. Graph. Hypertrophy. A. Increase in cell numbers. B. Newborn. C. Underdeveloped. D. Increase in cell size, increased development. E. Poor development. The answer is D. Increase in cell size, increased development. Between means what? A. Inter. B. Infra. C. Intra. Between means A. Inter. Like intervene or interject. Hepatoma means what? A. Incision of the kidney. B. Inflammation of the liver. C. Red blood cell. D. Tumor of the liver. E. Blood mass. Hepatoma means D. Tumor of the liver. Flesh is? A. Sacro. B. Spleno. C. Sarco. Flesh is C. Sarco. Iatrogenic. A. Cancer-producing. B. Pertaining to producing a tumor. C. Produced by the mind. D. Cutting into a tumor. E. Pertaining to produced by treatment. The answer is E. Pertaining to produced by treatment. What is a network, reticulum, of canals within the cell? A. Endoplasmic reticulum, ER. B. Nucleus. C. Lysosome. D. Mitochondria. The answer is A. Endoplasmic reticulum, ER. What protects and regulates what passes into the out of the cell? A. Cytoplasm. B. Cell membrane. C. Mitochondria. D. Lysosome. The answer is B. Cell membrane. Where are chromosomes located? Inside the where? Nucleus. Cytoplasm. Mitochondria. Or lysosome? The answer is A. Nucleus. How many pairs of chromosomes are there in the human cells, not sex cells? 20, 23, 25, or 46? The answer is 23 pairs. What cells are specialized for receiving impulses? A. Collagen fibers. B. Adipose cells. C. Dendrites. D. Axons. The answer is C. Dendrites. What specialized structures are scattered throughout the cell, which perform jobs within the cell? A. Nucleoli. B. Chromosomes. C. Organelles. D. Phospholipids. The answer is C. Organelles. What is the largest cell in the human body? A. Cardiac cell. B. Smooth muscle cell. C. Sperm. D. Ovum, egg. The answer is D. Ovum, egg. What are tiny cells with long whip-like tails called flagella? A. Sperm. B. Ovum. C. Epithelial. D. Nerve. The answer is A. Sperm. Kata means A. Up. B. Down. C. Before, forward. Kata means B. Down. Such as catabolism. Dilation of a lymph vessel. A. Cholecystolithiasis. B. Lymphangiectasis. C. Cholecystolithiasis. D. Lymphangiography. E. Lymphocytosis. The answer is B. Lymphangiectasis. Pain in a joint is? A. Ostealgia. B. Arthritis. C. Arthralgia. D. Osteoarthritis. E. Arthralgia. The answer is C. Arthralgia. Cystoscopy means what? A. Visual examination of cells. B. Removal of a sac of fluid. C. Removal of the urinary bladder. D. Study of cells. E. Visual examination of the urinary bladder. The answer is E. Visual examination of the urinary bladder. Inflammation of the nose. A. Rhinitis. B. Nephritis. C. Hepatitis. D. Arthrosis. E. Dermatose. The answer is A. Rhinitis. Neutrophil is A. Polymorphonuclear leukocyte. B. Mononuclear cell. C. Platelet. D. Lymphocyte. E. Monocyte. The answer is A. Polymorphonuclear leukocyte. Not breathing. A. Apnea. B. Apnea. C. Apnea. The answer is C. Apnea. Pain in the ear. A. Osteitis. B. Neuralgia. C. Otalgia. D. Otitis. E. Pleurodynia. The answer is C. Otalgia. Select the correct meaning for the following combining forms of hepato. A. Liver. B. Blood. C. Kidney. The answer is A. Liver. Cell. A. Cell. B. Softening. C. Hernia. Cell means C. Hernia. Clotting cell. A. Platelet. B. Platelet. C. Platelet. The answer is C. Platelet. Select the correct meaning for the following combining forms for pedo. A. Bone. B. Disease. C. Child. The answer is C. Child. Select the correct meaning for the following prefixes. Dis. A. Abnormal, bad, difficult, painful. B. Against, opposite. C. Through, complete. The answer is A. Abnormal, bad, difficult, painful. Lysis means A. Blood condition. B. Softening. C. Breakdown, destruction, separation. The answer is C. Breakdown, destruction, separation. Skippy means A. Process of visual examination. B. Excision, removal. C. Instrument to visually examine. The answer is A. Process of visual examination. Epi means A. Below. B. Above. C. Between. The answer is B. Above. Half means is A. Dia. B. Hemi. C. Thigh. The answer is B. Hemi. Difficult digestion. A. Dysphagia. B. Deglutition. C. Aphasia. D. Dyspepsia. E. Polyphagia. The answer is D. Dyspepsia. Excision is A. Ectomy. B. Dynia. C. Centesis. The answer is A. Ectomy. Small artery is A. Lymph vessel. B. Blood vessel leading from the heart. C. Venule. D. Capillary. E. Arteriole. The answer is E. Arteriole. Blood is held back from an area. A. Hemolysis. B. Anemia. C. Hematoma. D. Thrombocyte. E. Ischemia. The answer is E. Ischemia. Another name for stored energy. A. DNA. B. RNA. C. ATP. D. Gene. The answer is C. ATP. D. Gene. Pnea. A. Flow, discharge. B. Drooping, sagging, prolapse. C. Breathing. The answer is C. Breathing. Necro means A. Death. B. Rule, order. C. To bind, tie, connect. The answer is A. Death. Without oxygen. A. Anoxia. B. Oxia. C. Anoxia. The answer is A. Anoxia. Viscera is A. Tissues composed of cartilage. B. Cells in the blood. C. Internal organs. D. Cavities of the body. E. Parts of cells. The answer is C. Internal organs. Ultrasonography is A. Radioactive material is injected and sound waves are recorded. B. Abdominal X-ray recording. C. Amniocentesis. D. X-ray recording of sound waves. E. Sound waves and echoes are used to create an image. The answer is E. Sound waves and echoes are used to create an image. Medical term for the throat is A. Larynx. B. Pharynx. C. Coccyx. D. Esophagus. E. Trachea. The answer is B. Pharynx. The tailbone is the what? A. Ilium. B. Coccyx. C. Cervix. D. Sacrum. E. Cranium. The answer is B. Coccyx. Adipose means A. Cell. B. Fat. C. Bone. D. Dip. E. Blood. The answer is B. Fat. Adeno means A. Cell. B. Fat. C. Bone. D. Gland. E. Blood. The answer is D. Gland. The space in the chest between the lungs. A. Mediastinum. B. Retroperitoneal space. C. Peritoneum. D. Pleural cavity. E. Esophagus. The answer is A. Mediastinum. Tachycardia means A. Bad, painful swallowing. B. Rapid heartbeat. C. Inability to swallow. D. Near the windpipe. E. Rapid breathing. The answer is B. Rapid heartbeat. Study of cells is A. Cystology. B. Dermatology. C. Cytology. D. Hematology. E. Pathology. The answer is C. Cytology. Select the term that is spelled correctly. A. Syndrome. Or B. Syndrome. The answer is B. Syndrome. Pertaining to the abdomen is A. Abdominal. B. Abdominal. C. Abdominal. The answer is B. Abdominal. Correct spelling of slow heartbeat is A. Bradycardia. B. Bradycardia. C. Bradycardia. The answer is B. Bradycardia. Collection of blood is A. Hepatoma. B. Hepatoma. C. Hematoma. The answer is C. Hematoma. Select the term that is spelled correctly. A. Tracheostomy. B. Tracheostomy. The answer is B. Tracheostomy. Select the term that is spelled correctly. A. Arteriosclerosis. B. Arteriosclerosis. The answer is B. Arteriosclerosis. Retro means A. Before. B. Behind. C. Front. D. Above. The answer is B. Behind. Itis means A. Sweet. B. Inflammation. C. Top. D. Pain. The answer is B. Inflammation. Label the image. Ready? 1 is anterior, ventral. 2 is posterior, dorsal. 3 is deep. 4 is superficial. 5 is proximal. 6 is distal. 7 is inferior. 8 is superior. 9 is medial. 10 is lateral. 11 is supine. And 12 is prone. Make sure you know all these positions. Now, let's label this image. A is endoplasmic reticulum, ER. B is ribosomes. C is mitochondria. D is cell membrane. E is nucleus. F is chromosomes. G is cytoplasm. Please learn about this cell and its structures. Trans means what? A. Of. B. Superficial. C. Across, through. D. Outside. The answer is C. Across, through. Which one below means rib? A. Cosco. B. Costo. C. Ducto. D. Carpo. The answer is B. Costo. Status means what? A. Falling, drooping, prolapse. B. Development, nourishment. C. Stopping, controlling. D. Flow, discharge. The answer is C. Stopping, controlling. Auto means A. To. B. Against. C. Down. D. Self, own. The answer is D. Self, own. Crine means A. Outside. B. Inside. C. Secrete. D. Breathe. The answer is C. Secrete. Globin means A. Fat. B. Protein. C. Carbs. D. Sugar. The answer, B. Protein. Ophthalmo means A. Foot. B. Hand. C. Eye. D. Ear. The answer is C. Eye. Osteo means A. Fat. B. Child. C. Skin. D. Bone. The answer is D. Bone. Levko means A. Red. B. White. C. Yellow. D. Green. The answer is B. White. Which one below means red blood cell? A. Erythrocyte. B. Leukocyte. C. Adipocyte. D. Cystocele. The answer is A. Erythrocyte. These are only some of the questions. Don't forget to review your book, do all exercises in your book, and keep watching these videos. Thank you for watching. Please subscribe, comment, like, and share.